love and COVID. So I can see, Sharon, you have magically appeared in our midst. Sharon has over 24 years of healthcare experience and is Vice President of Global Development at ETR, as well as the Managing Director of Youth Tech Health, otherwise known as YTH, who, as I said in the beginning, is one of the 3 founding partners of AMAZE and works closely with us on all of our international development and websites and everything that makes AMAZE amazing for you all people. So I will let Sharon take this away. I'll see you all in chat, and then we'll be back to answer some questions with Sharon. Sharon, we can't actually hear you, Sharon, but I'm sure you were saying wonderful things.
Lincoln, can you hear me now?
Wow, there we go. Magic.
Technology.
Okay. Now I will let y'all. Now you are in good hands, everyone.
Thank you. All right. Good afternoon, good evening, everyone. I am super excited to be here today. That was an amazing session, hearing young people's voices and guiding our work based on their lived experiences is obviously the way to go. Often looking around at what's happening in our world, I feel anxious and stressed, and then I engage and interact with our youth leaders and young people, and I'm like, we're going to be okay. They've got it, yeah? So with that flavor, I'm going to start talking about something that we did a couple of months ago with the beginning of the COVID epidemic. Love in the time of COVID. Let's see if I can make this go. Fantastic. Like Lincoln was saying, my name is Sharon. I'm the Managing Director of the White Initiative of ETR and VP of Global Development. And part of my work as an AMAZE partner is really to look at what's happening in the global sector with young people, adolescents, through the lens of sexual and reproductive health, and then see how we can engage them in our global expansion. So around, I would say like end of February, a lot of our AMAZE leadership was actually in Turkey to attend a gathering organized by UNESCO, where they brought in a number of youth influencers, global influencers from different countries, to really give them the stage and hear them, listen to them, and see what was really happening in their life to guide sexual and reproductive health work globally as well as in the US. We came back from that meeting with a lot of excitement, a lot of ideas, and then guess what happened in March, right? The COVID pandemic hit all of us and our lives changed significantly. The unforeseen challenges that were caused by the pandemic, they've taken a significant role on young people in the world. The impact on the populations have been diverse, and depending on where you are and who you are, that has created a situation where we've had to take a step back and really look at what is happening in the lives of young people through the sexual and reproductive health lens. There have been school closures, increased economic insecurities, forced isolation, limited access to face-to-face social support. With all those things happening, there's an urgent concern about the health and well-being challenges that are being faced by adolescents in the US and globally. So, in keeping with the theme of listening to young people and hearing what they have to say, we actually wanted to speak to those global youth influencers and see what was happening, because the alternative was to really go and speak to different young people in different countries, and that would have been quite challenging to do. So we went to the youth influencers in 19 different countries and asked them what they were hearing from millions of followers that most of them had. And so today what I want to do is share with you some of those findings, some of those recommendations. Hopefully you can take some of these findings and the recommendations and apply them to your work. But I also recognize that a lot of you are probably, in the sector trying to really work with young people yourselves. So there are learnings there. There are recommendations and ideas there as well. So please feel free to use the chat feature to add your thoughts and ideas so we can keep learning from each other. So today I come to you from my living room, like most of you are, based on the challenges in our lives. A lot of us are working from our homes. You will see that I have a virtual background because right behind me is a first grader and a seventh grader attending online Zoom school, which is a whole different story. We'll pick that up some other time. But right now, hashtag IRL, that's the lives that we are experiencing. So
And
going back,
Sharon,
yes.
on the same topic as hashtag this is life and this is what we're doing, I will say that some participants, you can see your full presentation view. So it's not full screen on the slides.
Got you. Lincoln, should we leave it there or do you want me to change the view so people can?
Yeah, if you're able to do full screen on the slides, they were just saying it's kind of harder to see when it's the full presentation view.
You got it. I am going to. All right. Is this better?
Wonderful.
Fantastic.
Look,
Technology.
hey, we're practicing what we're preaching, right?
Absolutely. Learn as we go along. So what we did was collaborated with UNESCO, and we said, well, we can't reach all the millions of young people around the world, but what we can do is reach out to the youth influencers and learn from them what they are hearing and what they are seeing from the people that follow them and from the people that engage with them. So that's where we are. So in March, we conducted a Zoom session. All of you are obviously very familiar with Zoom now, and we invited the global youth influencers to come and tell us what they were hearing so we could learn, and hopefully those learnings could be translated into actual action and activities and provide recommendations to different sex educators from different countries, including in the US. So after I think we did a Zoom session for almost 90 minutes. All the participants from 19 different countries provided their country context of what was happening in the lives of young people because of the pandemic. They shared their shared challenges. They highlighted the digital spaces and how they are responding to these challenges in the lives of young people. And so what I want to do today is share with you some of the high level findings. There were a lot of amazing things that came out of that meeting, but I realized that we don't have much time. So I'll be sharing with you a link to that report so you can go in depth if you are so inclined. The first thing that we asked all the attendee, all the consultants, the youth influencers, was what are the main topics, what are the main challenges around health and well-being that young people are facing? And there were several things that came out of that. We asked them, within the COVID pandemic, what are some issues that have been amplified? What are some issues that are new? And what are some things that they feel that adults, policymakers, and sex educators should know and understand so that they can respond to the needs of young people better? The main topics, the main themes that came out were around stress. There was amplified anxiety, loneliness, a lot of mental health issues that probably might have already existed in the community were further exponentially amplified. There was a rise in domestic and gender-based violence. There was also concern around too much screen time by young people. And a lot of the challenges came from actually finding it very difficult to access services and resources around mental and physical health problems. And there were limited service provisions for people who had existing mental and physical health issues. It was noted that these challenges for groups were compounded for groups who were already vulnerable. When the pandemic hit, that included people who had mental health issues, LGBTI plus young people, those young people with pre-existing health conditions, including young people living with HIV and young people living in poverty. So let's dive a little bit deeper into some of these topics. Because we are looking at it through the lens of sexual and reproductive health, let's start with that. Despite confinement, a lot of young people reported that they are continuing to exist and their sexual lives continue, and a lot of young people continue to pursue new romantic relationships where possible. This includes continuing to find ways to conduct sexual relationships. Access to contraception is not always easy and is not always a top priority during the pandemic. In addition, we've heard of reports from popular influencers that their followers are submitting increased questions about masturbation. They're looking for new ways to continue their romantic relationships in the context of physical confinement and isolation. This included exploring digital sexual health relationships, such as using text, video, etc. The increase of activity on online spaces to conduct relationships, that has given to increased concerns around consent and privacy. In terms of services, discussion about sexual relationships has led to questions about access to broader SRH services. Influencers have reported their followers asking questions about which services are still available and which services are no longer available because resources are being diverted to the pandemic response. In many places, the answer, there have been no answers. There's been a lot of confusion whether services are still open, whether it's still functional, how can I access those services, which for me are critical at this time. In other places, there are common reports around sexual and reproductive health services being seen as non-essential and therefore closed, with implications for accessing contraceptives and other SRH resources and services. There were reports also of young people saying that they feel guilty about accessing services related to SRH in case the health system is already overwhelmed with the COVID-19 related issues and the response, which currently everybody deems to be a priority because there are lives involved. As I said at the beginning, one of the key thematic areas that came out was domestic and gender-based intimate partner violence. There are many reports of increased domestic and gender-based violence at home. Young people are witnessing and in some cases directly experiencing this violence. Gender-based violence was reported to be increasing as people are, stuck with their partners in close confinement. For those who unfortunately might already be in existing abusive relationships, the abuse was becoming worse, that there are limited options to escape. And in some contexts, the increase of violence is actually opening much needed conversations about what was previously considered a taboo topic within the sexual and reproductive health world in different countries. And talking about vulnerabilities and vulnerable populations within our young people, there has been a strong message that communities that have traditionally been at risk, they're facing amplified vulnerabilities in the current crisis. Moreover, some of these communities are receiving the least attention from governments, policymakers, decision makers, and providers. This trend is particularly the case for young LGBTI plus communities. For those who are keeping their identity hidden, shelter-in-place rules can be especially challenging, with some reporting feeling unsafe in their homes. One participant reported that many young people have been kicked out of home because of their sexual orientation or gender identity. Young people from the LGBTI plus community have expressed concerns about the risks of sharing personal information when they're using apps and or other digital platforms for seeking new or pursuing existing relationships. Mental health, a very, very critical and key thematic areas in the time of COVID, especially linked to sexual and reproductive health. Increased loneliness, feelings of detachment, social isolation, and anxiety that is linked to COVID-19 is being reported widely. For school-age young people, stress and anxiety are largely linked to school closure and the pressure of online learning. I was just talking about the fact that Zoom classes have become the new reality, and that comes with its own challenge. Continued pressure from teachers and parents to excel in the context of these limited resources, and lack of support that has contributed to increased stress and anxiety levels. For learners at key stages of their education, for example, national exams, the stress of falling behind, not graduating, they have been really significant. For others, the anticipation of returning to school after the pandemic is a cause of stress and anxiety, partly due to fear that they have fallen behind, or for some, because school has not been a happy place to begin with because of bullying or other issues. Very importantly, those with pre-existing mental health conditions are finding it challenging to access resources. There was a perception that resources are being directed towards the COVID response, and that is again linked to the feeling of guilt for actually asking for help when young people feel that, oh, maybe the people who are hospitalized or needing more critical urgent healthcare, that's where the resources should be allocated. Some influencers also noted an increase in young people talking about suicide, and there is some anecdotal evidence of rise in teen and adolescent suicide rates. Online trends. We, are on an online space, in an online space right now, and we're talking about AMAZE, which is a digital sex ed campaign. So let's look at what's happening online in the world of young people. Unsurprisingly, youth are spending a lot of time online, obviously, both with positive social connections and negative overload of negative news and conflicting information and the ramifications associated with those. Young people are turning to digital spaces to connect socially, with apps like House Party becoming very popular. There was a noted increase in engagement with some Facebook groups and increased creative content being posted on TikTok and Instagram and other social media platforms. Another trend of interest in digital has been increase in digital sexual relationships. This has been reflected in a reported increase in downloads and engagement of dating apps such as Tinder, which has made features previously requiring a fee actually now free. These trends reflect sentiments from young people that they are tired of hearing about COVID-19 and constantly being reminded about the negative consequences. They want to be entertained and reminded of normal life. And dating apps are seeing an increase in subscribers. It's becoming very popular. And a lot of young people are actually using these dating apps to actually engage and communicate with each other online with the intention of actually building that relationships, opposed to maybe initiating a more in-person sexual relationship. Digital platforms are getting creative, especially on supporting young people's mental health needs. At the same time, mental health related content has not been context specific, and it doesn't adequately reflect the nuances of mental health problems that young people face. Moreover, more serious mental health illnesses people may be dealing with are not recognized in online content. On the other hand, it was noted that there has been limited specific effort to create and share SRH content specifically related to the challenges that young people are facing. And you will notice that on our AMAZE platform, we have responded to the pandemic by creating a lot of new content to respond to the needs of young people within the context of the pandemic. It was noted that much of the digital information and support specifically developed for young people was coming from grassroots organizations and not really as a comprehensive strategic effort from, say, national policymakers, national departments of education, or national departments of health. Now coming to a very important part of this presentation, which is how do we support young people? A lot of you are living this life every day, and I'm sure you have a lot of ideas and thoughts that you can share with us. So please do that in the chat. But what we heard from young people on what they wanted on how adults could support them was to focus on issues that they are interested in, rather than enforcing or pushing content that adults or providers are more interested in. Make sure that we identify and serve the needs of the most vulnerable groups so that they don't get lost in the pandemic. Position and provide contraception and other SRH services for young people as essential services, because that's what they are. These are essential services, and we cannot stop them because of the pandemic. We have to respond to the pandemic, obviously, but we can't stop providing these SRH services and resources that are critical for many of our young people. What we're doing today, what we did a little bit earlier with our youth ambassadors, meaningfully engage and collaborate with our youth leaders to make sure that our programming is youth-centered and directly meets the needs of their lived experiences in this pandemic. How do we use digital spaces? We are here today having this conversation so that we as a network and as a community can share challenges, can share best practices, and learn from each other and become better at responding to the needs of our young people. Let's recognize that our domestic and global youth community is diverse. They have unique and nuanced needs, right? We have to ensure that the global, regional, and local youth-centered responses to COVID, they acknowledge this diversity of young people's lives and are inclusive in our strategy and the execution of those strategies. Some of the things we want to talk about is, it's important to emphasize the risk of COVID, but it is also a fine balance to not overemphasize that risk. Let's move towards a broader health messaging strategy that has practical and detailed advice. Let's provide signposting to youth-friendly services for mental health, sexual health, violence prevention services that remain functional on platforms that young people are using, such as hotlines and online counseling. So, a lot has happened, and we have shared other resources with you. So I do want to leave you with another resource. ETR, our organization, has been working very intensely to respond to the needs of online learning. And we have a whole team that has been pushing out content, which is under the topic or category of design for learning. Teaching sexual health education virtually through live or self-paced delivery, providing an opportunity to reach students wherever they're located and getting creative with new teaching strategies. Some of those have been coming up in the chat since the beginning of this conference, and building those meaningful connections. So if you are interested in learning more, you can go to this website, etr.org/design-for-learning. We have created tip sheets for virtual vitality. So how do you take a lot of great work and great curriculum that have already been designed, and how do you translate that to a virtual world? Please feel free to access these free resources. And if you have any questions, do feel free to reach out to me or other people at ETR. And we are very happy to share additional resources with you, respond to your questions. And with that, I am going to end this presentation and hand it back to Lincoln.